Even in the midst of COVID-19 crisis, we all realize just how important the seamless urban movement of people and goods are. Since the outbreak of the pandemic in China, governments around the world have maintained a steady supply of food, medical supplies and emergency goods with minimal delays or restrictions. The public transport sector service providers' response to COVID-19 has shown that we have the right blend of mobility options, and through the public-private partnerships, people can travel safely to where they need to be or go, and deliveries can be made on time. But to what effect? Road transport in Kenya accounts for 80% of the total internal freight and passenger traffic in the country. With a growing demand for mobility, how does the public transport sector balance between the mobility and COVID-19 pandemic in the country? We are joined for that discussion by the key stakeholders here in the country who are known figures in the public transport sector. Simon Kimutai is the chairperson of the Matatu Owners Association, and Edwin Mukabana is equally the chairperson of an association that regards, of course, the public transport sector here in Nairobi County. Gentlemen, I appreciate your time. Thank you so much for making time. Simon Kimutai, coming to you first on this important note. How do you make an absolute priority the protection of public transport staff who keep the public transport up and running?
Well, it's been a very big challenge since the pandemic came in, and initially it was how to handle it. But so far, the investors in public transport have put in an effort to make sure that there is compliance as by the recommendations of Ministry of Transport of Health. It's been difficult initially because there are costs involved. You know, initially there was an advice that we have people staying at home. So when people stay at home, public transport operators don't have anything much to do. And then came in the reduction of passengers to be ferried. From there, then came in the curfew. So what we say here, we've tried so much. I think this time public transport industry needs to be congratulated because they tried as much as they could, because it's an interaction position where, as you said earlier on, that over 80% of Kenyans rely on public transport for movements. And when we talk of 80% in any area, there are lots of movements, which of course translate itself to economic activities. So initially it was a bit difficult because there were insufficient supply of sanitizers, masks, and so forth. But somehow they tried to provide what had been recommended by the Ministry of Health. So far, we've not had much cases transmitted through public transport, and we've not had cases where public transport operators or crew have gotten the COVID-19 disease. So far we say, despite the fact that we've had a beating by not having revenues, in fact, it's now in a big crisis in terms of loss-making as a business.
To the loss-making aspect, because economically, of course, it also plays a lot in terms of the contribution to the GDP of the Matatu sector in the country. Coming to Edwin Mukabana. Good evening, my brother. With regards to the pathogen's ability to travel, of course, that avenue can be provided only by the transport sector, and to be specific, the public transport sector, where a lion's share of the Kenyan population use. Therefore, what measures or mitigating measures are you putting in place to ensure that you don't become the avenue for the transportation of virus from one point to another, especially in the epicenter, which is Nairobi County? Well, if I may come up again, is the sound okay on your end? Okay, let me in the meantime continue with Kimutai as we fix up the technical problem with Edwin Mukabana. Kimutai, if I may come to you again in regards to the same question, in regard to the provision of an avenue for travel for the pathogens here in the country with regards to COVID-19. Of course, that avenue can only be provided by the transport sector, and to be specific, the public transport sector, which accounts for lion's share of Kenyans here in the capital, Nairobi. What mitigative measures are you adopting to ensure that that issue is addressed?
Well, there are recommendations. Of course, it's not our own formations. There are recommendations by Ministry of Health. And we've tried as much as we can to be able to provide service based on recommendations in terms of maintaining recommendations by the Ministry of Health for purposes of trying to avoid spread of COVID or coronavirus by, you know, and we cannot create this by ourselves. So this one, given recommendations given, and we try as much as we can to be able to provide. For instance, when we have to keep the social distance, vehicles that were carrying 14 passengers were reduced to 8, and we complied with this so that they may be able to keep that distance. Just in case we have an infected person, we will be able to provide a safe distance. What we've actually urged those using the service is that they have to play a role, you know, because it's their lives at stake. What is important here is for every person to play their roles. Like, for instance, they have to provide masks for themselves. We cannot afford to buy masks for every passenger who comes in the vehicle. So by good luck is that every person is trying to play their role, and we've played the role of providing sanitizers. You have to wash your hands with the soap before you enter, and there are areas where vehicles have got to be cleaned using detergents or those recommended detergents before other passengers come in. So we are trying as much as we can to be able to be compliant with recommendations already put by the Ministry of Health.
Okay, let me now engage Edwin Mukabana, who we have now and have fixed his the technical problem. Coming to you, a total shutdown, or more or less a partial shutdown, is not a measure that has been taken by the county of Nairobi, which is the epicenter of the COVID-19 pandemic or cases here in the country. How significant is it then, still on you, Bwana Kimutai, is it to establish areas of action to mitigate the risks of COVID-19 pandemic? And is it not also a priority on your end, despite the millions of profit that you make as an industry, to ensure that you also service out some of Kenyans who cannot afford essentials like face masks and hand sanitizers?
One thing that I want to put straight is that public transport is a loss-making venture or business. So when you talk of millions, that are probably, they are not millions in profits. They are revenues collected, but you've not looked at the costs of operation. One is that as we talk now, we are making losses up to the tune of 70%. If you look at other jurisdictions, you'll find that governments provide subsidies to public transport because it's a provider, or it's a I would say it's a facilitator to economic activities. Let's put that aside. When we talk of revenues collected by the vehicles, there are costs that are involved that we might not be able to cater for all what has been recommended. For instance, we cannot be able to provide masks, as I had indicated earlier on. So that should be an individual's responsibility to ensure that they have masks. I'm happy that Mutahi Kagwe, the CS Health, has put it that it's mandatory for any person who's going to get to a position where they're going to interact with people, they must have masks. So I believe that if everybody is compliant, for us, we'll provide what has been recommended. We will sanitize, we'll provide water and soap. We will even provide sanitizers to ensure that the vehicles are cleaned and fumigated for purposes of not harboring the virus. So for us now, we would say, let other people at the same time, or provide service users, be able to play their roles. It's important because it's lives at stake. So we don't wait upon public transport operators to provide everything. for their journeys to be successful and their lives to be, for them to be safe. So it's important that everybody plays a role to ensure that there is no spread of this pandemic.
Okay, even as you mentioned that aspect about the government coming to, giving or instill some aspect of, lubrication with regards to liquidity in the transport industry. I mean, this is perhaps an association or an industry that tends to be disorderly. It's actually an intricate system that involves quite a large number of different players, including cartels and an underworld with an unpredictable form of shape. Therefore, how does the government address your problem, even as you seek to ensure that you don't become the avenue for the travel of the pathogens from one point to another here in Nairobi?
We have tried so much to engage the county governments and the Nairobi Metropolitan Services that let them waive even parking fee, so that this can be used to as a benefit to all of us, including the passengers, by being able to buy sanitizers. The government has not provided, but I want to thank some private sector organizations like the Kenya Association of Manufacturers to stretching their hands to give sanitizers to public transport operators. But you find that, we are very many. As you say, 80% or over 80% of the millions of Kenyans rely on public transport for movement. And any person who comes in needs to be sanitized. If a vehicle, for instance, handles 200 passengers in a day, how much does it cost to sanitize one passenger? So this is a cost that cannot be left alone to public transport operators. Otherwise, they will soon stop because they cannot be able to meet their operational costs. So it's important, as I say, other related parties like car manufacturers, assemblers, bodybuilders, to come in to help public transport operators in providing what has been recommended, so that we don't become a conduit or we don't become an agent of spreading the virus.
Okay, even as you tend to adopt that sort of the responsibility angle or perspective to ensure that you don't become the avenue or the channel for the spread of COVID-19 pandemic, allow me now to engage Edwin Mukabana, who my director tells me is now set for the interview. Coming to you, Mr. Mukabana, I mean, there of course definitely is at the moment the aspect about, of course, the impact assessment in regard to the rebound effect due to the timetable adjustments and, of course, the demand in mobility from people in wanting to travel from one part of the county to another. In terms of assessing all these and providing general information, how are you adapting and coping in the new times that appear to be extraordinary, even for you stakeholders in the transport industry?
Thank you very much. There was a bit of technology challenges here. I couldn't hear you, though I could see I was online.
All right.
There are many challenges that have existed for us as operators. One being that, of course, we are not carrying to full capacity. Two is that when you have a lockdown between one county to another, that means that you're limiting your mobility from one center to another. Three, that when the time of operation is reduced from the usual maybe 15 hours a day, and you're now doing maybe 12 hours a day, then you are losing passengers. And also when you realize that you have to bear other costs, probably this has been discussed before, like sanitizing, and you've got to have all those challenges, becomes a challenge. But what we are trying to do is to cope with it and make sure that we follow government guidelines, just to ensure that people are able to move despite the fact that we are not making money at all, but we have to keep moving people as part of our contribution to the existing coronavirus environment.
Okay, and even as you mentioned those important points out, well elaborated, of course, and outlined in regard to the role that you are playing in ensuring that not only do you adhere to the government's guidelines, but equally ensure that in ensuring that you become a very vital player in the response to COVID-19 pandemic. But speaking of that element, there has been the talk about digitization, or like, for instance, the industry that you, of course, belong to, coming up with issues like e-ticketing, so that there is less now sort of proximity between the ticket seller and the people? And would this not have helped if you have adopted this idea earlier, and perhaps might be the point with which we reduce the COVID-19 pandemic in the country?
Yeah, that is very true. The COVID-19 has just augmented the problem as it is, and as operators, we have always thought that we should have come in much earlier to do the ticketing. However, I think we have not been left behind. We are doing several tests right now to see if we can use mobile money, or we can use any form of a card system to ensure that we are putting. So the tests are going on right now, very intensive tests that are supposed to make us go online as soon as we can. The reason why we want to go online is specifically because our people handle cash, our conductors handle cash, and cash is the media of exchange. And you know very well that there's no point sanitizing, making sure that you're keeping distance, and then you are touching cash that could be contaminated already. And that is a big concern when it comes to our staff. We do not only care about our passengers, but for the most important, we also think about our staff, whom we don't know how they will. Remember, this money will have to be taken by a conductor, it will have to reach the office, it will have to be counted by a cashier, and all this is contamination. So this is a challenge. The other area where we are concerned about is contact tracing. And we are working with the different agencies to try and see if we can test a system or apps which can be able to aggregate the number of people that were in a particular vehicle in any particular day. So that if, for instance, we have a person who probably was ill and was on a vehicle and we need for contact tracing, it is easy to do so. That does not mean that already long distance people do not have passenger manifests. Yes, we know passenger manifests are already there, but up to the ground, and especially in the CBD or in the urban transport, this has been a challenge. So we are very concerned about it.
Okay, even in that regard, as you say that you are putting in place effective measures to contain the spread of COVID-19 pandemic in the country, what about the employment of additional measures? For instance, if I may just cite these administrative controls which regards training of your staff, plans, policies, and producers to reduce the infection rate in the country?
Oh yes, we have had a few of our people being trained with the CDC here to ensure that they are able to know how to cope. For example, if you come to some of the places where our drivers come from, you'll find we are testing them with a thermometer, a digital thermometer, to ensure that everybody who is going on duty is thoroughly vetted before he takes a bus. We are ensuring that they wash. If they're using any form of ticketing system, we ensure that the system is sterilized. And the vehicles in the depots or wherever they are parked, we are trying to insist that they must be fumigated every so often. And they must also be able to ensure that they clean the surfaces frequently touched by passengers. For example, handrails, where people are always touching when getting into the vehicles. All this is done in addition to ensuring that they are having face masks, just to ensure that they are safe. So we are putting all this together, and all this goes into training. You have to keep training them, you have to keep telling them, you have to give them avenues of how they get the information, tell them about 719, how they can get to report an incident. We have given them numbers of county health officers to ensure that they are able to quickly call a number if they see somebody that is ill in the vehicles.
All right. Well noted point. Let me cross over to Simon Kimutai, who is also standing by for this discussion. Simon, talk to me about the already underlying deep structural problems in the matatu sector here in the capital Nairobi, of course, punctuated by fluctuating fares, poor working conditions, competition, formation of cartels, and unpredictable stops and routes. Does this further compound and supplement the already existing problems amid COVID-19 pandemic crisis when we're in the midst of this calamity?
Thank you. Thank you. Allow me to say hello to my colleague Kabana. And one is that public transport operators have faced with many challenges. And when you talk of cartels and disorganization, we know very well that this has been history, and it requires a moment for any person or most leaders to think on how they can be able to retrieve this very important sector and put it in standards that conforms good practice standards in the world. The challenge that has come in now is a challenge that has never been experienced before. And it's important that we note that even before the virus came, there were big challenges in the industry. But, when it comes to this now, what has happened is that the biggest challenge we've had is that there are not many people now moving, with the recommendation of people staying at home and the reduction of passengers on each vehicle, as has been mentioned by Kavana. The curfew that has been reduced, the working hours, this has reduced revenues. And revenues is what we are after. No organization can perform its duties without meeting its costs. So there have been big challenges that has compounded all this. But somehow, as I had told you earlier on, we've tried our best. Most important thing is that we are committed into providing service, despite the fact that we are making losses. And right now, it's not an issue of cartels and other problems that are faced by the industry. It's about ensuring that Kenyans travel from one destination to the other without probably spreading the virus by being careless. So we are trying our best as an industry to be able to provide a service that is acceptable and a service that probably is safe, and people to get to their destinations without probably getting or having to be infected. So as we are made to understand, we will treat every passenger as a person who's infected. We are suspicious of every person. So to be able to avoid anything happening is that people must comply with what has been recommended by the Ministry of Health.
All right, even as you point out, the aspect about, which is appreciated, about the drastic drop in mobility because of the drop in demand of services from the people, then the point I mentioned earlier was about already existing problems, which are, structure problems in the matatu industry. Post-COVID-19, when the dust settles, how will you still address them? Because they will, of course, in the foreseeable future be the problem that continues to dot the public transport sector, especially in Nairobi County.
I think for now it's important to concentrate on the problems that we have at hand. When it gets to coming back to normalcy, we'll be able to handle. You know very well that this is an industry that has had no regulations for very many years before Michuki came in. And there is a culture that grew and has made the industry quite unmanageable and portrayed a very bad picture. Now, as for now, we would say that the problems that are faced by the industry are enormous, and it requires proper good legislation and proper enforcement. The biggest problem we've had in the industry is an issue of interests. Mm-hmm. You had mentioned about cartels, and cartels are quite wide. It's not only probably those boys who are the bus terminis. We have policemen. They are also cartels because they have so much interest. They are not enforcing the law as it is required. They use the law to extort money from public transport operators. So the problems that are faced by them is so enormous that requires a different forum to be able to be addressed well. As for now, I think we would have to concentrate on issues of COVID-19 in terms of executing our responsibilities of providing reliable movement in the country.
Okay. Well, you have noted good points, but I'm sure these problems will remain and will, of course, be the underlying problems, which are the bottom line in the end that need an address. Coming to you, Edwin Mukabana. I mean, when we look at the challenges in the matatu industry or the public industry, you mentioned the Kenya Bus Service, which was owned by the Overseas Transport Company of London, post-independent Kenya. And then there was the formation of the first private-public partnership, PPP, in public road transport, that is transport sector, which is PRPT. Then it remained the sole proprietor until the 1970s when matatus came into the picture. Where is the coordinated response here in regard to ensuring that we have an orderly public transport sector in the country, not only then in the subject line of COVID-19 pandemic, but equally settle the already problems that exist and have existed in the sector that you belong to as a stakeholder?
Yeah, thank you very much. As you will realize that Kenya Bus Service started operating here in 1934. And this is about the same time the Transport for London started operating. You can see that over the years, we have degenerated to what we have, and London Transport is where it is. The main reason has been, I think, to me, about 2 or 3 reasons. The first reason is that the government has not had a good interest in investing in public transport. There was a very, very good attempt initially to bring in Nyayo Bus services, which would have brought public transport to be managed by the government. But that was coming too late after they had left where they would have done proper investment, that is using the stake that they had in Kenya Bus through Nairobi City Council, where they had 25%, and that would have enabled them to move forward. You note that when Kenya Bus used to operate a franchise, and this is what we are calling the PPP, it was a shareholding structure that both of them had stakes. But the regulation was so hard such that whereas the private operator was supposed to provide services, Nairobi City Council was supposed to regulate. You could not open a route without being authorized. You could not increase fares without being authorized. So any investment you did in the industry, the government had an eye, and this was done very well until 1973, when the private sector decided to join and were given leeway without proper regulation, like Kimtai had said. Now that started bringing the problem. But that would still have been managed if the second aspect of it had been taken care of. And the second aspect would have been, please train the manpower to run transport. As it is, and like I've always said, you cannot run an industry like now the Ministry of Health without properly trained people. Ministry of Health is coping because it has got well-trained people funded by government. Now, we continue to have a scenario where we still operate under free market. And that is the third aspect, that when it came to 1991 and the structural adjustment program came in, a lot of people who had been, can I call it, retrenched from government, decided to buy Nissans. And by so doing, they started taking over the market share that was there for Kenya Bus and making competition very high. Now that has led to nobody controlling the entry, and they have left the market to be a free entry where anybody who wants to join, joins. When you leave transport to a free market, you certainly get where we are. These are some of the challenges that we have.
All right, well noted points. Gentlemen, let's now come to the tail end of the broadcast here in regard to the discussion that we are having. If I may come to you, Simon Kimutai, there is the element about, of course, the burden on the transport industry where, of course, you belong to in regards, of course, the fuel cost, the cost of operation because of the lessening in the number of passengers that you carry at any given time. However, is there hope in regard to the pump prices owing to the cost of crude oil across the world, which has plunged. For instance, in the United States of America, where Donald Trump had to inject some form of liquidity to the energy sector in the United States of America. Will this offer a reprieve for the transport industry in the country in terms of the cut down in the number of passengers, but the pinch which will be, of course, at some point offloaded at the price point of the gas stations across the country?
Fares are not only a factor to be considered in putting in what to be paid as fare. Pump prices could fluctuate, but it's only one of the elements that determine the fares of journeys. Let's take, for instance, if today, as we had the other day, 10 shillings reduction per liter.
All right.
Of diesel. A vehicle could consume 30 liters in a day, as that is as per today's operations. 30 liters would amount to 300 shillings. 300 shillings, and if you've had maybe 100 passengers in that particular day, I'm talking as per the kind of movements that we're having now, you'll find that 300 shillings, even if you wanted to pass the benefit to passengers, and you've had 100, is 3 shillings. We don't even have those denominations. What I'm just trying to say is that this has no significance in terms of impacting on costs of running the business. Right now, when we talk of costs, we do cost accounting. We look at the investment. If you've put in 5 million shillings for a minibus, what would you recoup to get back what you have put in as an investment? These vehicles depreciate by between 10 and 15% per annum.
Okay.
So if you look at all this, fuel is just but a fraction of an element of a cost. So there's so much that needs to be considered in terms of looking at business as it is. It's unfortunate that in this country, transport is a business. That is just like any other business when you open a shop and you've got to realize return of investment. So we really must consider all these things before saying that it's only service provision. So it's very important when we look at costs that the government has completely abandoned public transport sector and looked at it as an area that would provide movement, and there are no subsidies. Mukabana can elaborate on this because he has been exposed internationally on issues of public transport because he's worked in London.
All right.
What do successful jurisdiction provide for transport to be sustained? So Mukabana can elaborate on the same.
All right.
For us, we see practically that it's not practical the way things are on public transport in this country.
All right. If I may come to you then, Mukabana, in regards to the price crash across the world, and one final question here as we end here on the program, will it offer a mutually advantageous outcome in regard to, one, for the cost cutting on the users of public transport, and you in terms of meeting your operation costs?
I do not expect that to affect us a lot because the price that has crashed is the New York price. We don't get a lot of our fuel from the New York price where there is a crash. The price we get comes from mostly Singapore and the East. So in that particular region, prices may not be as drastic as minus the way it is, but we might get it for maybe $20 per barrel. But that comes 2 months later because the fuel that we're getting right now was bought about 2 months ago. That's when the auction was done. So by the time that trickles back here, it will take a bit of time. But coming to fuel, yes, it's a big cost. just like in the developed world, labor is a big cost. Our biggest cost of operation is normally fuel. Sometimes it takes about 30% or 40%. But that is not the only cost. If you take the revenue leakages that we have that goes to cartels, police, NCC, it takes another 30% of your revenue. So you find that it becomes very, very difficult for you to do the operations. Then there is the cost of compliance that comes in. You have to have a speed governor, you have to pay advance tax, you've got to
all right.
Pay all other things. But I also want to mention that the fuel cannot reduce because 50 shillings of the fuel price is government taxes. So unless the government gives us a stimulus, says they're going to give us a tax rebate or a fuel rebate, or remove completely because they have continued adding VAT on fuel, which was never before, then this would have assisted us a lot. And by this, I think I would like to appeal that just like in London, where transport has asked for an economic stimulus, it is important that we consider an economic stimulus for at least the workers in the industry, at least the people, because when you hear buses, we are carrying less, but we are carrying all. For example, some people with almost 300 buses, they're only operating 30. That means the other buses are packed.
All right.
They're just sitting there.
Asante sana Edwin Mukabana, chairperson and a key stakeholder in the matatu industry in the country. Unfortunately, we're out of time. I'm told to get out. Simon Kimutai, thank you so much. The chairperson of Matatu Owners Association, I thank you so much for joining us here on the broadcast. And thank you to our other guests who have joined us from the Kenya Medical Training College, too, of course, and Professor Wajakoya. Unfortunately, we ought to have heard the regional manager, Rift Valley of the Kenya Red Cross, in regards to the response the government has laid out with regards to the mudslides in West Pokot and Elgeyo-Marakwet counties that killed people over the weekend. We end it on that note. Let's have the update in regard to the international news, that is the COVID-19 pandemic, and the coverage provided by the Johns Hopkins University Center for Disease Control. And this is, of course, in regard to the version. Of course, this is, as you can see on your screens, the total confirmed number of cases, 2,665,122. The total confirmed number of deaths, 186,181. Regions or countries affected by the COVID-19 pandemic, number 185. So we come to the geography outlook in terms of the hotspot and the epicenter at the moment, which is the focal point of the World Health Organization, led by Dr. Tedros Adhanom Ghebreyesus, which is the United States of America. But there are equally concerns in Africa with regards to the capacity question that the World Health Organization says that Africa has in response to COVID-19 pandemic. It appears that the red shaded area in Asia, which was in China to be specific, appears to be clearing up since the Chinese government managed to put the pandemic under control, despite, of course, the criticism that have been raised by the institutions in the United States of America and the UN system in regard to the use of lies, cover-ups, and repression by the Chinese authorities in clamping down on dissent and the lack of media freedom in reporting the COVID-19 cases. You have the graphics outside China, or in Wuhan, which is the epicenter of the pandemic, flattening, of course, in China. And in Europe, there appears to be the containment measure put in place, which are working, especially in Italy and in Spain and in the United Kingdom. But you can see in other places like the United States of America, represented in the below bar graph, where cases continue to rise, and this is a concern for the World Health Organization. When you come to the mapping in regards to the play issue here, you can see from the onset how it threaded up from city of Wuhan in Hubei province, spread all across the world, came to Europe. There has been a concern in Italy with regards to the measures put in place by Giuseppe Conte's government. Then in Spain, where Pedro Sanchez, the Prime Minister, also had to lock down the country. In the UK, where Boris Johnson tested positive. In Germany, where Angela Merkel was so positive with her people, telling that, to be honest with you, 60 to 70% of us will be infected. Now, there's Donald Trump in the United States of America, who has misjudged the situation, ruled out the virus, said it was a Chinese-owned virus, and the concern is that America is now having more than 800 cases when you look at the numbers provided by John Hopkins. That's 845,959 in effect to the response by the Donald Trump administration. We come to the aspect here in regard to the confirmed cases and how these cases have spread across the world. So when I play, you can see how these numbers are interchanging very fast in regard to the confirmed number of COVID-19 cases across the world. China was topping at first. The Diamond Princess in Japan was also a point of attention. Singapore, Japan, Thailand, South Korea, Taiwan, Iran, Malaysia, and you can see how it's changing. And by the end of this timeline, you will see that America will top and 5 European countries will come next. China will be, of course, down in regards to the containment measures put in place, which included the full lockdown of Hubei province, which is in China. Now you can see how the timeline is speeding in effect to, of course, as of 10th of April 2020. So you will come to up until when the cases were last recorded, which is on the 22nd of April 2020, 2,601,794. And that is, of course, 24 hours less than the numbers provided by Johns Hopkins University. The airline across Kenya here, seeing, of course, the county of Nairobi, we only have presumably here a countable number of flights, including this one. If I click on it, you can see this is an aircraft type Pilotus PC-12 5Y-5FDP, and serial number not provided. And this is, of course, on a vertical speed. This is crossing over from Raskamboni, which is in the border between Kenya and Somalia. Then you come to this jet, which is a Jeddah in Saudi Arabia bound flight from the Kenyan capital, Nairobi. Aircraft Boeing 777-FFG, aircraft type number B77L in bracket. Then we can see this one, and perhaps this is Qatar Airways from Nairobi. And this is, of course, Airbus A330-243F from Nairobi, heading to presumably Doha in Qatar. Thank you so much for joining us here on the broadcast. That's where we come to a close here on the Primetime News, and we do appreciate your, of course, comments. Let me just sample some in regard to the hashtag provided on Twitter. That was, of course, NewsCompass as regards the discussion that we had, which is in regard to the COVID-19 pandemic. And let me sample some in effect to that, of course, on what you have tweeted. This is Francis Irungu says, we need an active mode in terms of our transport system. The government must take over the entire operations. And we have Mohammed Awal says, in the future, I think we should consider government-controlled transport sector. This is in regard to the COVID-19 pandemic. And of course, there are very many, but we can sample all at the same time because of the pandemic. And of course, we wish Muslims who will be fasting for the holy month of Ramadan, either tomorrow or the day after, happy Ramadan Kareem and Wasom Makbul. We'll see you next week here on the broadcast on Monday on New Day from 11 a.m. to 1 p.m. and we'll leave it at that. Thank you so much for watching. Stay tuned. Good night.